Welcome back. Experts say teens everywhere are hurting. Since the COVID-19 pandemic, teenagers are struggling with anxiety and depression more than ever before. That's why city health officials have launched a new tele-mental health service called TeenSpace. It offers teenagers the help they need by connecting them with a licensed therapist through phone, video, and text.
Joining us this morning with more on this new resource, New York City Health Commissioner Dr. Ashwin Vasan. Nice to have you back on. Good day.
Thanks for having me.
So what is your office finding about teenagers and mental health right now?
Yeah, I think you kind of led into it. The rates of things like loneliness, hopelessness, depression, anxiety, and sadly suicidal thoughts are higher than we've ever seen them. They were getting worse before the pandemic, and we think that digital devices and social media was contributing to that. But then the pandemic made things much, much worse. And so we're still picking up the pieces of that. And I have 3 small kids, and they're a little younger than the target audience for TeenSpace, but you can see the effect. So we're so proud of this initiative because
how does it work exactly?
Yeah, we're creating a digital front door to our mental health system, which we all know is a little hard to navigate, even for adults with good insurance. We're putting the power in the hands of young people, free of charge, without an adult at a school or anywhere else saying, this is how you do things, putting it in their hand on a device that most young people are native to, and saying, you can get help when you need it right away. You can get your needs met right away. You can develop a relationship online right away. Or if your needs are more complicated or you're in crisis, we'll get you to where you need to go.
With that crisis part, do you ever let the families know that they have a child that might be in crisis?
Well, there are privacy rules, but an adult, a parent, a caregiver has to sign off.
If they're younger, if they're like a teenager or 14, 13 years old, they can't just sign up on their own? Is that
TeenSpace is for 13 to 17-year-olds, so that's over 400,000 New York City young people, teenagers. They need an adult consent to sign on, but that's the only role of the adult other than the therapist themselves. So it's really democratizing access to mental health care. It's normalizing it for teens to ask for help, and we're stepping up and getting them the help they need when they need it.
And you know, you sort of mentioned I have a 10-year-old, and she's sort of just now getting in social media and all that kind of stuff. A lot of it is the connection to social media. Is that what you're finding, that sort of influences some of the mental health issues that these kids are having?
Certainly, it's playing a role. You know, when you look at the data, teen mental health started to get worse. Frankly, adult mental health started to get worse in and around 2011, 2012, which is when social media went on to smartphones. And so it's the combination of this immediate access and social media platforms, and that's also when you saw the rise of things like Instagram, more photo and video-based social media instead of just Facebook. And that's when we start to see things worse, because it's really pulled us apart and exposed us, especially our young people, to a lot of negative content that we're worried about.
Mental health issues obviously so top of mind, but for you, the opioid crisis continues to be a real issue, and you are urging all New Yorkers to carry Narcan with them. I know you have some with you here today. I mean, this isn't necessarily something that New Yorkers think that they should have with them. Why are you saying everyone should have one of these?
Because we're all a part of the solution here, and this is a life-saving medication that you never know when you're going to encounter someone in need, especially with fentanyl ravaging our city and ravaging this country. I would hate for anyone to not be prepared with this simple, easy, life-saving drug in the event that you encounter someone.
Is it easy to use?
It is extremely easy to use. So these are our free kits from the city, which we distribute at locations all throughout our city. You can find it on nyc.gov/naloxone, and they're free of charge. And they come with 2 doses of naloxone through nasal applicators. So just like a nasal spray, you pump one spray into the nose.
Rosanna and I were talking. I used to carry one of those in my backpack when I rode around in the subway. But I would always think, would I actually know when to use this on someone? You see so many people, maybe they're sleeping, maybe they're sort of having some other issue.
Well, that's really a key question, and that's why we've trained nearly 11,000 New Yorkers just this year on how to use naloxone, and you can get trained. Basically, what you're looking for is not just someone who's sleepy, but someone who looks like they might actually have trouble breathing, and someone with whom you're not able to arouse them through a sternal rub. So take your knuckles, rub it on their sternum, and they're not waking up. That's a pretty good sign if they have a pulse that there could be opioids on board. And the good news, and we were talking about this earlier, even if you give it and there's and there aren't any opioids on board, that there's something else going on, nothing happens.
Okay, no risks to
No
it.
side effects.
Can we talk to you about budget cuts? Is your office facing budget cuts?
It's a difficult time. No one wants to be doing this.
Because you got a
least
lot of
all the
freebies
mayors.
going on there. That's why I'm asking you.
Least of all the mayor, right? I mean, no one wants to be in the midst of these kinds of cuts. We're trying to navigate our way through it and minimize disruptions to essential services like naloxone and TeenSpace. TeenSpace is fully funded and is already out the door, and we've already got hundreds of signups.
Well, let me ask you about like the needle giveaways, the vending machine that has free condoms and free crack pipes and everything like that. Is that going to be hit by budget cuts, or is that funded by whom?
Well, look, we get a variety of funding for a variety of things. In fact, most of our funding at the health department comes from federal grants and state grants, not from city dollars. So we're impacted. We're trying to minimize disruptions.
Do you know what you're going to cut yet?
Yeah, I mean, we've certainly submitted what we need to.
Anything you want to share with us?
Any layoffs
not
or
really.
anything along those lines? Any layoffs or staff or anything like that?
No,
that you
we're
think?
really trying to focus on, the health workforce has really been hit by the pandemic. We lost 20% of our nursing workforce in this city. Social workers are leaving the field or going to the private sector. So we have these vacancies that we've struggled to recruit. We've really focused a lot of our attention on those vacancies and really protecting our active personnel.
Well, what could you cut? I mean, right? I mean, you know what's going to be.
Yeah, it's tough. We're just trying to do it so we minimize disruption to services. But as the mayor said, this is going to hurt, and I think New Yorkers will see some effect.
All right, but you're here to talk about TeenSpace.
That's right.
How can people access this and find it?
So they can go to talkspace.com/NYC or nyc.gov/teenspace. Log on. All you need is that one parental permission, and download the app, and you're good to go. Anytime you want, on demand, within minutes, you can get mental health care you need.
They've also launched that vaccine program all throughout some of the poorer neighborhoods in the city as well. I know we're running out of time, but that's another thing that you guys are doing as well.
Absolutely, and that's federally funded. That's through CDC grants.
That's good. All right, New York City Health Commissioner Dr. Ashwin Vasan. Nice to have you on Good Day New York.
Always a pleasure.
Good luck
Thank you.
balancing the budget.
A lot of work to do, no doubt about it.